And nobody wants to go through this. Our job is to just try to get them through it as good as we can. And just to be able to do this again and be able to let people know, hey, you know what? You're in a good spot. It's going to be okay. We're going to do whatever we can for you and your family. Mm-hmm. And I just am proud to be part of that. I am so blessed. I was in the right place at the right time. I think it was meant to be.
Hi there. Welcome to 1 in 8, a podcast series brought to you by Sanford Health. I'm your host, Courtney Collin with Sanford Health News. This series continues an important conversation all about breast cancer awareness because 1 in 8 women will be diagnosed with breast cancer during her lifetime.
Good morning.
Lynn Roemeling is a friendly, familiar face inside the Sanford Oncology, Hematology, and Infusion clinic in Sioux Falls.
Hey, Katrina, are y'all done?
Yes.
She is a patient access representative, which is a position she's held with pride for 13 years.
I'll be checking in patients, checking out patients, making their next appointments. So it's a lot of fun. I love my job.
But in June of 2020, that job and life outside of work came to a pause.
I had a mammogram that showed up a little abnormal, and so ended up getting a biopsy and found out I had breast cancer. It was a whirlwind after that.
Suddenly, Roemeling was the patient and started her care journey at the Edith Sanford Breast Center with a triple negative diagnosis, which is a rare type of breast cancer.
It's a scary thing for anybody to get that diagnosis. To be perfectly honest with you, I was waiting for the day for it to come because my family has been full of cancer.
Her grandmother and sister both had breast cancer, so she had a feeling it was a battle she would eventually fight too.
It didn't come as any big surprise to me, but still when you hear that, it's like, oh my gosh, what's going to happen now? Am I going to make it through this? How am I going to feel? You're overwhelmed with emotions at that point in time. It's just very hard to explain, but it's scary. It's very scary. Started treatment practically right away. Got done with treatment and had a double mastectomy. I had my nurse navigator. I have my oncologist. I have my surgeon. I have my plastic surgeon. They did ask me if I would be willing to go into a trial, which I gladly did, just because if it can help anyone else in the long run figure out, if this is something good or not, I wanted to go ahead and do it. My worst enemy was fatigue. It just totally drained me. There were a couple times when I finally had to quit working that they would have to take me out in a wheelchair, and that just killed me because I didn't want to sit at home and do nothing. So it was very, very scary, but I knew that I was in the best place to go through this. And man, you can't have better support than I did.
That support included a comprehensive care team of specialists to personalize her journey through treatment with their advanced training and technology, tailored care to her genetics and type of cancer.
To know that I was here just made it so much better. I mean, to have the doctors here with you. And
where would you be without your care team?
Oh, maybe it, would have come back, or who knows. But I mean, I had support every step of the way, and it wasn't just my oncologist. I mean, it was all the doctors rooting for me. It was every nurse practitioner taking care of me and asking me how I was and what they could do, and the people in the infusion center and even my own team. Yeah, I can't say enough about this place.
Beyond breast cancer, as she alluded to earlier, Roemeling's family knows cancer, sadly, too well. The disease took both of her parents many years ago. Her mom was diagnosed with ovarian cancer and her dad pancreatic. Today, her oldest son was diagnosed with prostate cancer, her youngest, Hodgkin's lymphoma, and her daughter passed away after her fight with colon and liver cancers. More than most, Roemeling understands the value of life and knows she's right where she needs to be.
When I first interviewed at Sanford, I interviewed at 3 different places, and this was the 3rd place, and I interviewed all 3 in one day. And I got here, and it was just like, this is where I want to be. This is my job. So I was so thankful when they offered it to me. And now, being on both sides, I mean, I knew kind of what cancer was like and so forth and so on because of my family history. But until you go through it yourself, it's not quite the same. You see what they go through, but until you do it, it's not the same.
Yeah. Was that wristband cut off?
Yes.
To come back and know or feel like I'm in the spot that I belong in, and just greeting these people. I know everybody comments on my smile because I'm always smiling, and I think that's half of your battle is your attitude. You need to keep going, you need to keep fighting, you need to have that. And so I try to bring that to every person that comes here. Anybody that I don't usually bring up that I've had it myself, unless it's a person that is really down and scared. And then I try to mention just, you know what, I've been through what you're going to be going through, and it's going to be okay. We have a great team here, and if anybody can get you through this, they can. They're here for you every step of the way, and I just can't say enough that, you know, fight, just fight, and we're here to help you.
An attitude of gratitude and encouragement for each new Sanford patient facing a similar journey.
Hey, Cammie.
You get patients that are just mad at the world. And, you know, why me? Why is this happening, all this? And they're mad and they're gruff. And you know what? They've been dealt a blow. And nobody wants to go through this. I mean, our job is to just try to get them through it as good as we can. So if there's anything we can do, you know, call. Stop in, do what you have to, but we'll be there. And just to be able to do this again and be able to let people know, hey, you know what? You're in a good spot. It's going to be okay. You know, we're going to do whatever we can for you and your family. And I just am proud to be part of that. I am so blessed. I was in the right place at the right time. I think it was meant to be. I just can't thank everybody enough here, and I definitely can't thank God enough, because evidently He wanted me on this earth a little longer to do what I'm doing too, and I'm glad that I can do it.
Okay, you are good to go. You have a good day.
You too. Thanks.
Thank you.
For Sanford Health News, I'm Courtney Collin.